Any question from members? Is there a Senator Nielsen?
And the witness makes a good point about marijuana. As the bill moves along, or as the legislature continues to consider such legislation, I highly recommend we consider marijuana too. For our youth, I think that's a far bigger problem than tobacco.
Thank you. We have backup material that is endless to support our request for that amendment. And just, you will be taking a major step nationally. We have national press watching your action. Leadership.
Madam Chair, if I may, I'd like to respond. It's not that I'm opposed to including marijuana, and I've asked my staff to look into it, but if you may recall, it was an initiative put on by the vote of the people. I don't know if we can legislatively make that amendment. It may have to be done back through the vote of the people, which we're going to verify that. But at this point, it's not that we're opposed, but keep in mind this was an initiative that was passed.
Right, and council, we did talk with council about this.
We will continue to look at that.
Thank you.
So.
Was there a motion? I didn't.
Yes.
Okay, there was a motion. Would you like to close?
Respectfully ask for an aye vote.
Thank you. Please call roll.
Hernandez.
Aye.
Hernandez, aye. Nguyen.
Aye.
Nguyen, aye. Hall. Hall, aye. Mitchell. Aye. Mitchell, aye. Manning. Manning, aye. Nielsen. Nielsen, aye. Pan.
Aye.
Pan, aye. Roth. Roth, aye. Wolk. Wolk, aye.
9-0, due pass to appropriations.
Thank you very much. Final bill is SB 275. Madam Chair and members, this bill directs the Office of State Health Planning and Development to adopt a regulation that would add physician identifiers to the list of data elements that hospitals and surgical centers are already collecting and reporting. The bill is based on a RAND report that found that all of the states that have a discharge data reporting system, California is the only one that does not routinely collect physician identifiers. We already do this for other types of procedures, coronary artery bypass, graft surgery, and the risk adjustment outcome reports for the procedure that has led to better outcomes. The physician community has expressed concern about ensuring the accuracy of this information and protecting against the misuse of this data by ensuring that any public disclosure, including risk adjustments and a process for physicians to challenge the data. I agree that how the data is used must be carefully considered, which is why this bill is requires this to be done through regulations. I think the rulemaking process is a good place to work through the complexities of the data collection and eventually use the data. However, I am open to including protections in this bill, and I am committed to working with the physician community should this bill move forward on what those protections should look like. And with that, Madam Chair and members, I respectfully ask for an aye vote.
Witnesses in support?
Sawait Siem with Health Access here in support.
Michelle Cabrera with SEIU California. As the senator mentioned, California is the only of the 48 states that currently collects this information that does not include the physician ID according to the RAND report, and it will make the data far more useful in terms of assessing the quality of care delivered, and because we're strong supporters of healthcare transparency, we are in support of this bill. Thank you.
Any other supporters? Any witnesses for opposition? Oh.
Sorry, just cut me off guard with your hair.
Madam Chair, members, Tim Madden representing the California chapter at the American College of Emergency Physicians, and we have an opposed unless amended position. We appreciate Dr. Hernandez's comments in working with us and some of our concerns as it relates to risk adjustment. One of the things from an emergency physician's perspective we just want to emphasize is that to just include physician identifier can be very misleading. So think of a person coming into the emergency department in a car accident. The emergency physicians will treat them. Most likely they will move in to have a trauma surgeon work with them as well. You have an anesthesiologist involved. They could be admitted in the hospital and have multiple physicians work on them. So when it comes to reporting the outcome on discharge, who does that get attributed to and how is it apportioned? So some of these are some of the questions that we've posed to Dr. Hernandez's staff, and we're looking forward to working with them as we go down the pathway. Thank you.
Thank you, Madam Chair. Members, Amy Durbin with the California Medical Association, also opposed unless amended on the bill. CMA agrees that accurate and reliable data is important and also feels that it's important that any program for collecting the data meet certain quality, accuracy, privacy and review standards, and would like to see some inclusion of those parameters in the bill. The committee's analysis included many of those things that were in our letter on how to accomplish those standards by putting them into the language, and appreciate the senator's willingness to work with us on addressing those concerns moving forward.
Thank you. Questions from members?
Yes.
Senator Monning?
Thank you, Madam Chair. I'm supportive of the goals of this, and I guess just one question I had for the author, consistent with some of the concerns raised, but mine goes more, it's confidentiality of patient information, but also are you open to exploring safeguards against the sale, the data mining of this information for profit generation? In other words, we've seen it with pharmaceuticals where data is collected, repackaged, and sold to try to direct and influence prescribing habits. And I would just like to see some safeguards that the use that it's intended for, that it's restricted to that use. So again, it's something I'd like to, work with you on as this moves forward. But that's my concern, as a potential unintended consequence of the data mining of this information for other for-profit purposes.
And I share the same concerns. Now, keep in mind that all data, especially medical data, is under the purview of the HIPAA and HIPAA violations, and everything that's transmitted should be transmitted in either encrypted, and the data that we're going to be looking at, I'm assuming, will not have patient information. But yeah, I definitely agree that you need to make sure that none of that information is either sold or information is put out inappropriately.
Right, and it seems like that would be a easy safeguard to be explicit about. And even where there's patient protection under HIPAA, if physician information is provided, if somebody's looking at a physician's engaging in certain surgery practices, then they become a target for the marketing of the latest equipment. So anyway, that's the concern, and look forward to working with you as this moves forward. Thanks.
Thank you. Senator Pan?
Yes, I want to thank you first, Senator Hernandez, for bringing this bill forward. I do support your goals of increasing transparency. I think one of the things we need to be sure that we have mechanisms in place, and I appreciate that your statements about working with the medical community and the rulemaking process is that that actually people have access to what I call meaningful information. So there was data, and then we're talking about risk adjustment. And if the risk adjustment isn't done correctly, you can have unintended consequences. And actually, one of the potential unintended consequences I'm sure we avoid, and I've seen this in other times when people have disclosed data on, quote, physician performance, is that high-risk patients, if the risk adjustment isn't done correctly and you don't have stakeholders all weighing in to figure out how to do it correctly, you could actually discourage providers from wanting to see high-risk patients, because not in a case in the emergency room, you just have to see everyone who comes in. But, for example, other types of procedures where people say, well, all it will do is make me look bad on the score, so I'm going to try to avoid those patients and try to get them to somebody else and so forth. So I do think that we have to be sure that the data actually represent accurate information, that there's a process in place to be sure that the risk adjustment is done appropriately, that there is a wide stakeholder input into that development, that methodology, so there's agreement on the methodology, so that actually becomes useful information and that doesn't create disincentives for taking care of particularly high-risk patients. And I know that you're going to be working on that, so I hope I can be helpful there. And certainly I'm going to support the bill because I think it's very important to move this conversation and to move this idea forward. But I'm hoping that we can that we can try to address that as the bill moves forward.
Senator Roth?
Well, I just wanted to say I appreciate the willingness of the author to work to make sure that we have accurate data, because without accurate data, the data is worthless. And also, I'm sure you're going to work to make sure that we don't diminish the number of healthcare providers who are willing to see patients, given what we're trying to do with the Affordable Care Act. But I guess for the Medical Association, I'm just curious, how does adding physician identifiers to the data file allow a user to re-identify patient level data? I'm talking from our analysis, so you may not have it.
Yeah, and that was actually a concern that we had raised as well in our letter. It was actually in, I believe, the RAND study itself that they had discovered and thought that there would be a concern that by now, including the physician identifier data, that you could be able to link in certain instances that data to the patient data that was de-identified when it was released publicly. So just the concern on how, certain things will be identified and how it's going to be released, the distinction between the collection and the release on how you make sure in that process that there wouldn't be anything to compromise the privacy of the patient.
I see. Well, we certainly need to work to make sure that privacy is protected, and I know the author will do that. I'll be in support of the bill. Thank you.
Thank you.
Any closing?
Respectfully ask for an aye vote.
Okay, there is a motion by Senator Roth. Please call roll.
Do pass to appropriations.
Oh, thank you.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Hall, aye. Mitchell. Mitchell, aye. Monning. Monning, aye. Nielsen. Pan. Pan, aye. Roth.
Aye.
Roth, aye. Wolk. Wolk, aye. 7.
So it do pass to appropriation. Thank you.
Thank you. We're going to go ahead and lift the calls. We're going to start off with a consent item, item number 7, SB 299, Monning. Call the absent members.
Hall. Hall, aye. Roth.
Aye.
Roth, aye. 9.
That has 9. That bill is out. Item number 2, SB 19, Wolk, do pass to judiciary. Call the absent members.
Hall. Aye. Hall, aye. Mitchell. Aye. Mitchell, aye. Pan.
Aye.
Pan, aye. Monning. Aye. Monning, aye. So it's 9.
That has 9. That bill is out. Item number 4, SB 140, Leno, do pass as amended to appropriations. Call the absent members.
Nguyen. Hall. Mitchell. Mitchell, aye. Mitchell, aye. 6 to 1.
That has 6. That bill is out. Item number 8, SB 326, do pass to appropriations. Bell, call the absent members.
Nguyen. Hall. Aye. Hall, aye. Mitchell. Aye. Mitchell, aye. Pan.
Aye.
Pan, aye.
That has 8. That bill is out. Item number 9, SB 361, Hill, do pass as amended to appropriations. Call the absent members.
Hall. Aye. Hall, aye. Mitchell. Aye. Mitchell, aye. 9.
That has 9. That bill is out. Item number 10, SB 476, Mendoza, do pass as amended to appropriations. Call the absent members.
Hall. Aye. Hall, aye. Pan.
Aye.
Pan, aye. Mitchell. Aye. Mitchell, aye.
That currently has 9. That bill is out. We're done. And that concludes the business for the day, and we are adjourned.